Thank you for watching the World Community Magazine's Hour of Power Live on Facebook with your hosts Edward McQueen and April Garner.
Wow, we are live again. Good evening. I'm your host, Ed McQueen, for today's broadcast, WCM Live. And of course, our co-host, my dear sister, April Garner. She's kind of working behind the scenes today due to some other priorities, I guess. And we're gonna move from here. And glad to see our audience. Glad to know that you're tuning in for us today, because if you've seen the promotion, it's one of those things where our community is being torn upon by this continuous, I call it problem, which is better known as diabetes, that is hitting our community very hard. And it's been that way for a while, and we don't seem to talk about it enough. So this broadcast, we were dedicated to just talking about, well, that among other issues. And our guest, of course, is none other than Dr. Winston McIver. But before we get to that, we have the Porterfield Report. Everybody's probably acclimated, has gotten acclimated to now to that, and it's a beautiful report that they come to bring us every time there's a county council or city council meeting in Conway, and we certainly welcome that, because I don't think the communication has been that great. It's been out there, but other things have taken up priorities for people doing their viewing pleasures, of course, and that seems to be the case. So we're taking the opportunity to have it brought to you as they saw it, and I'm sure they're going to have a good report. So we welcome our two hosts from the Porterfield family, the Porterfield Report. That's Destiny and Desmond. And they always have a lot to talk about. Okay, it's specific. It's more specific than anything else. So welcome, the Porterfields, Desmond and Destiny. How y'all doing today?
Good.
You're good?
Yes, sir.
Good. It's a pleasure to have you coming on first. Okay, because absolutely, because today has been voting day, right? Voting.
Yes, sir.
Right, and of course, you all had got the first-hand information from yesterday's council meeting as to and what to kind of expect, and give us a flavor of what happened. So, on you.
So yesterday we went to the council meeting. They talked about, here and there. One thing that they talk about when they was doing, I think it was the public's input. There was, I think, one guy who was upset. He was just going on, and he was talking about how, like, the city tore up like his stuff where he worked, and he was turning it around, talking about if he tore up the city stuff, how would they feel? And he hasn't got paid for what the city tore up in like 3 years, and he still hasn't got paid yet. So I was sitting there, and he just kept going on, but he wouldn't get straight to the point. So the mayor said, "May you get to the point," and he got to the point, and we finally get to figure out what his point was, and they just said that they would see where it's at and see what they can do.
Okay.
And then also yesterday, it was a man that got up. They were talking about street performers, and like street actors, and about them licensing people able to do street performing. And they passed. Did they pass it? I think they passed it.
Yeah.
Yeah, they passed it to where if it's like if they're not licensed, they get fined. And like certain things that they do, they will get fined for it. So, what do you think?
So just saying, for all the street performers, make sure you have a license.
Yeah.
So, is that everything?
That's mainly it.
Okay. Well, you made a few points, few topics. It's something we haven't heard before. So
Yes.
anything that you thought that would impact your community right away or had some effect on your community? I know you said that you got to have a license for street performers and stuff like that.
Yeah, and also they talked about the Christmas parade and the tree lighting.
Oh, the tree lighting. Okay.
Yes, and about how they're gonna have 2 stages for that. So they're gonna do one where they do like the elementary kids for a second act, and they do the high schoolers for the first act. So it's not too crowded on the stage and nobody gets hurt. So it's
Okay.
And the Christmas parade is December 9th.
December 9th. Oh, okay. Okay. That's all the logistics that they gave you. I mean, did they give you where it's going to start, where from, and all that kind of stuff?
Not yet.
Not yet. Okay.
Not yet.
Okay. Good.
Not yet. And with what was it? Did it say they were going to start in November 30th?
I think at the end of November.
The end of November, that's when they're going to do the tree lighting.
The end of November.
Yes, sir.
Okay. Well, all right. At least we know a little bit about what the parades are going to be. And will it start from what part of downtown? Did they say it? I don't keep up with it a whole lot.
I think Laurel, in the little plaza, Laurel Street. I think on that street.
Laurel Street.
Yes, sir.
Okay.
Is that everything?
So really not too much from yesterday, but they were talking about the parade, street performers that you have to have a license, and about the public input, and that's pretty much it.
Okay. All right. Okay. Well, look, thank you all so much for that report. And I know you only had a day to prepare. And so we certainly welcome that and certainly appreciate your report. Okay. So we'll see you after the next council meeting.
Yes, sir.
When? Is that it? Every other Monday?
Every other Monday of the month.
First and third Monday of the month.
First and third Monday, yes, sir.
Yeah. Okay. Well, all right. Thank you so much.
You're welcome.
Okay. Great, fantastic. We always welcome that report from our youth like that, and looking for them to be major reporters someday. And so as we move further along, Doc. Doc's got another report, but he's got a report that's going to really impact us all, and we always welcome your expertise, Doc, your knowledge on your medical field, and every time I hear it, man, I think we call it palliative care.
Palliative.
Palliative care, right? That has a lot of weight to it, man. That has a lot of weight. Okay.
Yes.
So anyway, welcome to the program. And
thank you. We've been trying to make this happen for a while, and
Doc. Hey, you're busy, but that's good. Okay, you're busy. So what are you going to talk to us about? I know you're caring for all of us. So what are you going to talk to us about this week?
Well, we'll do this in a couple different parts. The first part is just talking about diabetes in general. And
diabetes in general.
Just talking about diabetes. Then we'll talk about some facts and myths about diabetes.
Right.
And some of the commonly asked questions that I hear in the office, and we'll kind of break that down into the myth section about diabetes. Some things that are true and some things that are not true. But just talking about it, do I sound okay?
Yeah.
Okay,
yeah.
all right. I see a lot of diabetics. I'll see at least 15 a day, and that's a minimum. But whenever I do these kind of talks, I just kind of like to simplify it so that way we can understand what diabetes actually is. So, without going into too much detail and becoming a pathologist, I'll kind of break it down this way. Diabetes is simply when there's just an excess of blood, of sugar that's in the blood. Now, insulin is the main hormone that's involved with diabetes and diabetes regulation. And what insulin's role is to help the blood sugars get into the cells so that the cells can adequately and effectively use the sugar for the work that needs to be done. In diabetes, there's two types of diabetes, two main types. Type 1, and in type 1, that's only about 10% of diabetics. Those people, their beta cells in the pancreas don't produce any insulin. So that's why they're usually caught early. They're usually young, usually children, early teens when that's diagnosed, but usually young children. And in that situation, the pancreas just produces no insulin. So in those patients, they have to take insulin because their body's not producing any. That's only 10% of diabetics.
Right.
90% of diabetics have type 2. And in those patients, their body produces insulin, but it's more of a resistant type insulin. It doesn't work like it's supposed to as time goes on. So that's why a lot of times early on, a person can just be treated with diet and exercise or can be treated with pills. But if the diabetes continues to manifest, it sometimes will progress to needing insulin or some type of injectable. Now, there is a third type of diabetes, which is called gestational diabetes, and we'll talk about that in a little bit later. But that's diabetes during pregnancy, and in that situation, it's about 6 out of every 100 pregnancies will have diabetes. The women will have diabetes. That's important, and that's why women during their prenatal care will get their blood sugars checked. But why it's so important to get early prenatal care, because the longer those sugars stay high, the bigger the baby can be, which can create issues with the baby and create issues with delivering of the baby.
So you're saying that it's possible that a baby can be born with diabetes illness?
Yes. So in other words, the baby can become more resistant because the mother is having these high blood sugars, and the high blood sugars are passed on to the baby.
Oh, okay.
So what happens is it's so important for mothers, if they've got diabetes, to get treatment. And usually in a situation in pregnancy, the treatment is typically going to be insulin for the mother. to try to control the blood sugars. Now, as I said, 90% of folks that have diabetes have type 2. Okay, so that's important to know. And the big thing about diabetes is what we call one of the big things is called signs and symptoms. Signs are what a physician would see. Things like recurrent skin infections, recurrent yeast infections in women, wounds that won't heal, dry skin, dry mouth, fatigue, headaches, vision changes. Those are what we call signs, things that can be seen related to diabetes. Not just diabetes, but it could be other things too, but that's something you'd have to think about as a physician. What the patient presents with are what are called symptoms. And the main 3 symptoms with diabetes are what's called the 3 Ps. Polydipsia, just drinking. Appetite is just drinking fluids because it's just constantly. Diabetes is a dehydrating condition. So the thirst centers in the body just tells you that you just got to keep drinking. That's called polydipsia. Polyphagia is where you just have a voracious appetite. You're just eating. Can't get enough. And then polyuria, which is the most common symptom, is when the person is just peeing all the time. Doc, I'm getting up, I'm peeing 10 times a night. Doc, I just can't stop peeing. I don't know what's going on. I'm urinating like crazy. So any one of those 3 signs, particularly the polyuria, is something that's really big for a person to be screened for diabetes.
Okay, but you mentioned about the person getting up all the time at night and just peeing. So how do you make the distinction between a person that deals with, from what I'm hearing, prostate?
Right. So in prostate, those people may get up anywhere between 2 to 4 times a night, depending on the size of their prostate. Right. With diabetes, these people are getting up 8 to 12 times a night.
Okay.
I mean, they're just constantly just urinating. It's just, and they clearly know something's wrong. Plus, a lot of times it's an unexplained weight loss. That's showing the stress on the body from diabetes, and that person needs to be seen, evaluated, and needs to get on some medication.
So unexplained weight loss.
Yes.
So a person who is a victim of obesity probably welcomes that.
Well, let's talk about it. That's a good point. Because when a patient comes to me and says, Doc, I'm losing weight, not all weight loss is for good reason.
Right.
Okay. So I had this conversation today with a patient. Sometimes the weight loss, particularly if the person's a diabetic or if they've got risk factors for diabetes, can be that the diabetes is uncontrolled. So I've got some patients that will lose weight, but their A1Cs and their blood sugars are still out of control. And they don't understand. They're like, well, Doc, I thought my sugar should be better because I lost weight. And I'm like, no, you're losing weight, but you're losing it for the wrong reason. Okay. Yeah. Now, whenever we're still talking about diabetes and evaluating, another thing we want to talk about is the risk factors. So family history is a major risk factor for diabetes. Being overweight is a major risk factor for diabetes. Lack of exercise is a major risk factor for diabetes. Elevated blood pressure and cholesterol are risk factors for diabetes.
Can we stop right? Can I interrupt you right there?
Yes.
Cholesterol part.
Yes.
Now, does that play a major part in one of the?
Well, it usually indicates that the person is probably not doing what they need to do, diet and exercise control.
Oh, okay.
So it's kind of an add-on to it. But the newest risk factor for diabetes is having greater than a 9-pound baby. So when I used to deliver babies, and we had these women that would have these huge babies. A lot of times, either the woman had gestational diabetes. Like I said, 6 out of every 100 pregnancies are associated with gestational diabetes. And if they had a greater than a 9-pound baby, the likelihood is that at some point in time, they may go on to develop diabetes themselves, usually because they had gestational diabetes. Now, a lot of times, you know, a woman may have gestational diabetes, and after she delivers, the sugars get better. But if that person has these risk factors that I named, particularly overweight, the likelihood is that they don't get the weight down and don't exercise more, that they will likely within the next 10 years develop diabetes themselves.
Doc, you already got some comments, some interesting people coming. They want to know, can you provide the from Vonda Cookie Vandross Brown? Can you provide the stages of diabetes? I believe you said 90% have stage 2.
Well, it's not stage, it's type.
Type. Okay.
So it's type 1 and type 2. Type 1 is about 10% of diabetics. Type 2 is about 90% of diabetics.
Okay.
Hello, cousin. She's my cousin.
All right. Hey, then you've already elaborated on the differences between the two, type 1 and then type 2.
Right.
And you now type 2 is acquired, or they both are
well,
acquired?
type 2 is, and so what happens is we don't know why the person develops type 1. So let me go back and say that. We know what causes, we know the end result, but we don't know why. Some people feel like just in development, those beta cells have not developed fully or adequately enough to produce the insulin.
Right.
And that's the leading thought.
Right.
I've had a patient who, an elderly patient, it's been about 15 years ago, that had a big viral infection, and it wiped out their pancreas cells, and they became a diabetic. And in that case, they had to go on insulin.
Okay.
Now, let me say this too. Just because you're on insulin doesn't mean you've gone from type 2 to type 1. Okay? So what happens is type 1 is type 1 and type 2 is type 2. But you can become insulin requiring type 2.
Now you got to elaborate a little bit more.
Okay, so let me go to the treatments. There's 3 main treatments for type 2. There's diet and exercise, there's pills, and then there's pills and injections. Actually, it could be 4, because you could say diet and exercise, pills, injections, and then a combination of pills and injections. But the first way that you try to treat type 2 is with diet and exercise. And if the person's numbers are just still high, still too high, then you have to give some kind of medicine treatment for it. Now, depending on how high the numbers are would be what we would recommend, whether we go right to the tablets or whether or not we say, look, we got to go to the injectables to get this down and then give a trial on the tablets at some point in time later.
Wow. Look, obviously, according to the comments, you become a role model for some people.
Okay. I can't see the comments.
You can't see. That's unfortunate. But anyway, it's from Thurman Brandon Hemingway.
Okay.
It says, Dr. McIver, you are my role model.
Okay. All right. Okay.
Now you see it. You see it now.
I see it. Thank you.
Yeah. Okay. Okay.
Thank you. So here's the other part. The diagnosis. How do we diagnose diabetes? The way we diagnose diabetes is you come to the physician, you get your blood checked. 3 fasting blood sugars higher than 126 is diabetes on 3 different days. Or any 1 fasting higher than 200 is diabetes. Okay.
Hey, run about it. It said, where does that number come from? It said, fasting?
Yeah, we're talking about fasting blood sugars now, meaning
Okay.
nothing for at least 6 to 8 hours at a minimum. So
Nothing to impact the blood sugar from.
right, exactly. So, and because that's determining how your pancreas is working,
Okay.
how the insulin is working. So it's 3 fasting blood sugars higher than 126, or 1 fasting blood sugar higher than 200. When you get those, the person has diabetes. Then you have to start checking something called an A1C. An A1C is a 3-month average of the blood sugar. Now, without getting too technical, it is measured by a protein on the red blood cell. The red blood cell has a life expectancy of 3 months. So that's why the A1C can determine adequately over a 3-month period what your sugars have been running. Ideally, we want the A1C to be less than 7. Less than 7 means your sugars are running less than 140.
So where did the number 7 come from, by the way? I mean, how?
Well, good question. It came statistically from research being done, and it's been shown that patients who have A1Cs consistently above 7 are at higher risk for diabetic complications. And we'll get into that in a second. Diabetic complications including strokes, heart attacks, amputations, those kind of things. So that's the reason why 7 is there. Studies have shown that people that stay at 7 or below are less likely, still possible, but less likely compared to people whose A1Cs are like 9, 10 or higher.
You know, you mentioned the word amputations. I think we wrote about that in the magazine maybe a few months back regarding the prevalence of amputations and if they are warranted
Yes.
in a lot of cases, especially in low-income communities.
Yes.
Okay. I don't know what compelled doctors to make the decision to recommend to their patient about whether that patient given a choice of amputation or another option, which is probably more expensive, in my understanding.
Okay, let's talk about that. So let me go over the complications and I'll come back to answer your question.
Yeah.
Complications, uncontrolled diabetes especially, will significantly increase your chances of a heart attack. Significant.
Right.
If you think about diabetes, it's an inflammatory condition. The blood sugars being elevated creates inflammation inside the blood vessels, which can inhibit blood flow, which can affect your heart.
Right.
It can also affect blood flow going to the brain, which could lead to a stroke. There's another complication. Another complication is blindness.
That's at any age, right? Almost any age. Stroke.
It's at any age, but the longer you have it, the more you have it and it's uncontrolled, the higher the prevalence of heart attacks and strokes.
Right.
First fact that I'll give you before I really get into the fact part. The number 1 cause of blindness in the United States is diabetes.
Wow.
The number 1 cause of amputations in the United States is diabetes. The number 1 cause of going on dialysis in the United States is diabetes. When I first came back home, some of the first patients that I had with diabetes actually thought that amputation and dialysis was a natural progression of diabetes. In other words, there are patients that I had when I first moved back home that thought that that was what was supposed to happen. So I realized at that time that a lot of education had to be done because that is not a natural progression of diabetes. It should not happen like that. The amputation part, just like the heart part, has to do with the inflammation in the blood vessels. Just like with the kidney failure, inflammation in the blood vessels. And if the kidneys aren't getting that proper blood flow, it will start to not function right. Then you get something called the creatinine and the GFR that starts to get abnormal, which puts more stress on the kidneys, which affects the filtering and functioning of the kidneys.
Okay. Yeah. That kind of concerned me a lot. I guess that's why we wrote about it a few months back. We just saw it happening too frequent to me.
Well, let me get to that part. So what happens is whenever there's some talk about amputation of a limb, it usually is because there's some ulcer that's not healing on a toe or the foot. What then happens is vascular studies are done to see at what point in the leg does the flow is not adequate. What they try to do is what's called a fem pop, to try to bypass or open up that part of the leg to try to get more blood flow down as far down as it can go, all the way to the toes. But sometimes it's so diseased down there until they can't open it up. And if they can't open it up, they've got to then talk about amputation. Because if they don't, that limb, that toe, that foot won't get the adequate blood flow. If it doesn't get the adequate blood flow, it's not going to get the adequate oxygen. If it doesn't get the adequate oxygen, it'll get gangrene and die.
Okay.
Now, gangrene can lead to something called sepsis. And if a person gets septic, they'll get infection throughout their body, and that can kill them. So usually a person with an ulcer that requires an amputation, you're worried about how far has this infection gone? Is it just in the tissue, or has it gone to the bone? And that's what we call osteomyelitis. Now, if it gets to the bone, and that bone can potentially be salvaged, you can do a bone scan and some evaluation to see how much of the bone is involved. And if it's not too much, you can put a PICC line in this person, which is an IV that they can walk around with. And that's typically 6 weeks of antibiotics.
Wow.
So that's why when ulcers are seen, it's very crucial and important to jump on that ASAP. Because if it gets to the bone, then now you're talking about the best that can be done is 6 weeks of IV antibiotics. And that may or may not take care of the infection.
Wow. What do you think about Deion Sanders' situation? Have you
without knowing the whole story, he does have apparently some degree of vascular compromise, where his blood flow's not as well as it should. Now, whether that's from diabetes, because not all amputations are because of diabetes. Sometimes it can just be genetically that they've got smaller arteries and he's just not getting blood flow. Not to mention trauma that he may have had during his athletic career that may have created some compromise to the blood flow. So I don't know his total story. I don't even know if he's diabetic or not.
Right.
So it depends. Amputations are not just because of diabetes. It is the #1 cause. Diabetes is but that's not the only reason why.
I think that's important. It's an important statement because I guess, like I am, I always thought that amputations were directly correlated with diabetes.
Well, it is, but it's not the only reason. There are other reasons why you can have an amputation too. There's a condition called Raynaud's phenomenon where the blood vessels just spasm and clamp down. A lot of times in that situation, those people are cigarette smokers. They may not have diabetes. It may be because of cigarette smoke. That's their complicating factor with that.
The nicotine.
Well, it's nicotine, but it's a lot of other ingredients in there besides nicotine.
Yeah, right. Yeah. There's a lot of, not just, you can change the name of those, call it ingredients, call them a lot of poison that's in there.
Oh,
right?
Yeah.
A lot of poison. So Doc, when we talk about going back to the foot or the feet, what about when you have continuous cramps in your toes or?
Well, the most common reason for that would be if you got, lower potassium, lower calcium. So that may or may not be diabetes related.
Okay.
Mhm. Now, one other thing I want to mention about complications in the eye. It's important for diabetics to get an eye exam every year. Like I said, the number one cause of blindness in the United States is because of diabetes, but there are other things too. Cataracts, something we call neovascularization, where you get bleeds in the back of the eye, and actually glaucoma can also be associated with diabetes. Not only diabetes, but it has a high prevalence in diabetes. Cataracts, bleeds in the eye, and glaucoma.
So it's more so if you have diabetes and you haven't had an eye check, eye exam, then that's something that should be done ASAP, right?
Yeah, a diabetic should have an eye exam every year.
Every year.
And then if they see some problem, then they'll have you come more frequent than that.
So how do they head off the blindness if they know that this person has diabetes and they go to the doctor and the doctor says, well, you know, this is happening because of diabetes, and what can they do to prevent the blindness from occurring, the full blindness?
It depends on what stage is caught. For one, it depends on what the cause is, whether it's cataracts, bleeds, or glaucoma. If it's cataracts, then you just, will get the cataracts removed. When I was in training 30 years ago, that was a pretty in-depth procedure. Now, these ophthalmologists can take a cataract off in 10 or 15 minutes. So that's one reason. So you get the cataract extracted or removed. The second thing is if you got a bleed in the eye, then you get actually injections or shots in the eyeball. And and then you go back to get it checked. And then the third thing, if it's glaucoma, you can give eye drops to reduce the pressure in the eye. I will tell you this, a lot of people don't know, but I will share this. After I had COVID in 2021, I had a bleed in my eye, and I actually probably gotten about 20 shots in my left eye since 2021. And right now we're still trying to figure out, was it just because I've got something called macular degeneration in my eye, whether or not it's related to diabetes. It doesn't appear to be diabetes, according to my retina specialist, and or whether or not it was related to COVID. My retina specialist and I are good friends, and we've agreed to disagree. I think it was related to COVID. There's more and more research that are coming out about eye bleeds related to COVID. But I had a normal eye exam in November of 20. I got COVID in January of 21 and had a bleed in February of 21. The only thing that happened in that 4-month period was I had COVID and got treated for COVID. So, but again, those it's injections in the eye, in the eyeball. That's how you would treat an eye bleed.
Wow.
So, so it's real.
Yeah, absolutely, man.
And so a lot of people ask me about, my weight loss and how much I've lost and that kind of thing. And that was part of the reason why I had to get in better shape, was because I developed some complications, which I believe was related to COVID. Again, I'm a diabetic too. So that was the other reason why, I had to get this weight down and exercise more.
Well, since you're a victim of diabetes, that further advances your knowledge on, because
when patients come to see me, I'm telling them, I'm not talking to you just as a physician. I'm talking to you as a diabetic too.
Right,
so when I'm going to give you something and I'm going to make a suggestion to you, it's something that I would do for myself.
Right. That's what I mean. Exactly.
I'm not just a physician that's just telling you what I read in the book. I'm not just telling you what I've done to treat other patients. I'm telling you because I am him.
Yeah, absolutely.
So I have a large diabetic patient base. A large. I probably have more diabetic patients than any doctor in Horry and Georgetown County, actually.
Wow.
That's what that's what the drug reps tell me. And they track that stuff. So I treat it, I take pride in treating it because I know what it can do. A lot of my family members don't have a lot of issues other than diabetes. So it does run in my family, particularly on the men. So it's important. It's important to me. It's important to me to do talks like this. I will do more talks like this in the near future in the community. Again, I was doing it pretty regularly for a while, and then COVID came and shut a lot of stuff down. But that's my next goal, is to get out and do more talks about this. Again, I'm not just telling you what I read. I'm not just telling you what I'm giving patients. I am a diabetic too.
You know,
And even though I've lost the weight, because I was up to 4 medicines for diabetes at one time.
you know, I look at it's very brave of you to admit these revelations, and for our audience, I hope they're taking that very seriously.
Well, I do, because there's a myth that physicians don't get sick. Now, I don't get a lot of sicknesses because I've been exposed to pretty much everything there is in the 30 years I've been seeing patients. But these things are not unique to just non-physicians. Physicians have these things too, but a lot of times physicians just don't talk about it. And I think to make it more relevant, to make it hit closer to home, physicians do need to talk about it.
You see the comment there. These people are very appreciative of your transparency.
Yes. Thank you.
Yeah.
So let's talk about some facts now. Okay? I've given you the diabetes. I've given you what it is, signs, symptoms, treatment, diagnosis, risk factors, complications. But let's talk about some facts right now, okay?
Okay.
It's estimated that close to 40 million people in the United States have diabetes. That's about 1 in every 10 people.
Right.
Okay? But 1 in 5 don't even know they have it.
Well, and that's a result of, you think, not getting frequent checkups or
Not
frequent
going
visits.
to the physician.
Not going to the physician. Well,
Now let me give you another fact. I said 37, almost 40 million people have diabetes. Another almost 100 million are pre-diabetic, meaning they've got blood sugars that are running higher than 126 or close to 126. That's 1 in 3 people.
and when I use the word that urologists use, the velocity of that number, that if they go to get a checkup frequently, they can determine you're right, the rapidity of it. I say the velocity that it's.
Yeah, you can determine it and you can jump on it faster. But out of those pre-diabetic people, out of those almost 100 million people that are pre-diabetic, 8 out of 10 of those don't even know that because they're not getting checked.
And I assume that since you deal with a lot of diabetic patients, you deal with a lot of them who come in during the late stages, and you have to give them bad news and stuff like that, or
About diabetes?
Right.
Yeah. So again, my talk on that is that diabetes is not necessarily a death sentence. Okay. You don't have to have these complications. You don't have, let's just get this under control so we can handle it. Because it's important. It takes a huge toll on the healthcare costs,
Yeah,
diabetes.
absolutely.
Diabetes.
And the government doesn't like to see that.
No.
You
And
know.
so, you know, it's very important because all these things that I named, all these complications, they definitely play a huge part in things that can be prevented.
So I pass by when we're driving sometimes, see an increasing number of dialysis institutions or buildings, whatever.
It's big business.
Yeah.
It's big business. But again, it gets to the point to where folks have a lot of times neglected their diabetes or were in denial, and that's what it led to.
Denial.
Mm-hmm. Every 7 seconds, a person dies with a diagnosis of diabetes or some diabetes-related condition. Every 7 seconds. It's projected that by 2030, diabetes will be the 7th leading cause of death in the United States.
That doesn't sound good. Because it hits. Is there a great disparity between the two communities, between the Black community and the white community, in terms of victims of diabetes? And
it definitely is. So African American adults are about twice as likely as white adults to develop diabetes.
And that's because of diet? Well,
there's a lot of different factors in that, and that's to be determined. But diet is one reason.
DNA, I guess.
The books or studies that say that we're more obese than non-African Americans. The books will also say that we're not exercised as much. But then you look at other socioeconomic issues, such as, the things that are cheaper to buy are worse for you.
Yeah.
I mean, you can go to McDonald's and a salad will cost you what, $5 or $7. French fries and a hamburger you can get for $2.
Yeah, that's something to think about.
Oh yeah, I think about it all the time.
No, that's really something. That's really something to think about.
Those are the socioeconomic issues. In our neighborhoods, in inner city neighborhoods, you've got, places that are cater more to things that are not necessarily the healthiest for you. So, it's estimated that almost 19% of African Americans over 20 are either diagnosed with diabetes or have undiagnosed diabetes. So in other words, almost a fifth of African Americans over 20 will have diabetes. So it's much more, all these things that I named, these complications, heart disease, stroke, blindness, dialysis, amputations, it's much worse in our community. You go to a dialysis center at any point in time, and 75% of them are going to look like me and you.
Yeah.
Who are on because of diabetes. Now, again, there are other reasons for dialysis. So diabetes isn't the only reason for dialysis, but it is the main cause of dialysis.
So I've got some other comments for some people that's not listed on the comment section, and it says what about the lack of nutrient-rich foods because people can't get fresh fruits and vegetables, which I think you elaborated on just a little bit a few minutes ago.
Yes.
Yeah. It's interesting that you made a comparison between they're charging you a whole heck of a lot more for something that's good for you.
Oh yeah.
Than something that's not.
Oh yeah.
In other words, the vegetables, the salads and versus the the hamburger, French fry, whatever. But the other thing is, wanted to know is diabetes reversible?
So let's talk about it for a second, because there's a lot of stuff that physicians will see that'll say, oh, this cures diabetes. Oh, we can give you this and it'll cure diabetes. So that gets into the myth, okay? So let's talk about it. Once you have diabetes, you always have diabetes. It doesn't necessarily mean you always need medicine.
Okay.
But
so you can stop your medicine over a period of time
if you do the right thing. If you exercise, you lose weight, you eat right. I'll tell you, I had this happen when I was a very young doc. This is when I was still just out of school. I was in residency actually, and I had a patient who did very well, lost a bunch of weight. A1C went down in the 6 range. We're able to take the patient off the medication. I told the patient, you still have diabetes, but the person in their mind, because they were able to come off of medication, they were acting like they didn't have diabetes. So guess what happened 3 months later? They came back to the office and I had to put them back on the medicine. So the point is once you have diabetes, you always have it. So if you go from pills, you go from insulin or injectables down to diet and exercise, you still got to watch what you eat. You still got to exercise because those numbers can go right back up.
So in essence, well, then it's imperative that you get checkup, a very frequent checkup, maybe every 3 months or something like that.
Diabetics should be seen every 3 to 4 months.
3 to 4
because
months.
Again, the A1C is a 3-month average.
Okay.
Another fact I want to give is for every 100 people that are diagnosed with diabetes, 21 of them have neuropathy. Neuropathy is where there's nerve damage. So for every 100 diabetics, 21 of those will have neuropathy, nerve damage, numbness, tingling, burning, stinging, nerve irritation because the sugar damages the nerves. Out of every 100 people that have diabetes, 27 of them will have some degree of kidney disease. Not necessarily raised to the level of needing dialysis, but have some issues with kidneys not functioning optimally. And out of 100, every 100 diabetics, 30 of them will have some degree of eye disease.
30 of them will have what?
Some degree of eye disease.
Wow. Okay.
So diabetes is a multi-organ condition.
Right.
It's much more complicated than just an elevated blood sugar because it affects the blood and the blood goes everywhere in the body.
Wow. Doc, look, what you've given us tonight, we don't charge people, but it's shit. I mean, this is very valuable information, and we just want to let our audience know that. And we try to bring on people like yourself who can enlighten our viewers to have a better life. Okay. So
it's important, like I said, I've only begun to scratch the surface on this. This isn't, this is just a scratch of the surface.
I'm going to say this and I'll talk about the closing. I did some literary research and I saw an article that said preventing diabetes health problems and said tip to get started. One was take your medicine on time. Do you emphasize that very highly?
Well, yeah, you want to try and be as consistent with it as possible, but it's not the end of the world if you take the medicine in the morning and then the next day you forget the morning, you take it in the afternoon. It's not the end of the world. As long as you take the medicine daily. Now, you want to try to be as consistent with it on time as possible. So if it's your morning medicine, take it in the morning. It's not like if you've been taking it at 7 o'clock every morning and then you take it at 11 o'clock, it's not going to be the end of the world. But you want to try to be as consistent with it as possible.
As possible. Yeah. And the other one was said to take care of your mental health.
Yes.
To be as less stressful as possible, to coping with stress.
Oh, yeah. So there's an organ in the body called the adrenal gland. The adrenal gland sits on top of the kidneys, and the adrenal gland's function is to produce steroids that the body needs to function properly. The more stressed you are, the more that adrenal gland will produce more steroids, which in turn can raise your blood sugars. So that's why when people are sick, their blood sugars typically go higher. That's why when they're stressed, their blood sugars typically go higher, because the adrenal gland is producing more cortisol, which is a steroid.
Okay, well, we're going to about out of time here, Doc. So we thank you, certainly thank you a lot for sharing this information today. We knew it was going to be valuable. That's why we had we knew it was going to be valuable and enlightening at that. And hopefully our viewers are taking note of this, very carefully note about dealing with this this health issue of diabetes, because it is.
You know, I recommend everybody. I mean, even for folks that are healthy, go to the physician at least once a year and get blood work done. Just even if it's just once a year annually,
right?
Go get blood work done.
Yeah,
they're taking the money out of your if you got insurance through your job, guess what? They're not gonna give you your money back if you don't use the insurance. They're taking it out of your check anyway.
Wow.
So go get checked. Be proactive about your health. Don't be that person who waits and waits and waits.
Okay, well, you've heard it. So, audience, and look, thank you so much again. And look, I know you have a lot more. You can actually talk about a lot more.
We can talk about this all day.
Talk about it all day. So, and that's why we're going to get you back on here again.
I do want to say this, though, before I leave.
Right.
November 14th is World Diabetes Day.
That's the World Diabetes Day.
World Diabetes Day, November 14th.
Right. I'd like to, when you're speaking on that about diabetes, which everybody will be receiving here in a couple of days, the new World Community Magazine. Front cover is Diabetes Awareness Month. November is Diabetes Awareness Month. And we put a focus on that and hopefully providing some more information for you that can help you to cope with this and go see the doc more often. Like he said, if you got, even if you don't have a job, I mean, get the blood tests is, I don't know, this is probably minimum cost, I believe, doc.
Yeah.
Okay. Anyway, thanks to everyone. And thank you, Doc, so much. Hope we will. Can we have you back on again?
Yeah, sure, definitely.
Okay. Looking forward to that. I'm sure especially people who send in comments, they're looking forward to that. So,
okay.
Thank you so much.
I gotta say one thing.
Yes, sir.
I'd be remiss if I didn't ask you to tell Sister McQueen hello. You know, I like you. I just like her a little bit better.
You're on the broadcast.
Hello, Sister McQueen.
You're on the broadcast. All right, brother.
All right, take care.
Thank you so much.
All right.
All right. So there you have it. And look, before we leave, by the way, just want to put in this plug. Everybody for the upcoming, which hasn't been done in about 2 or 3 years. It is the Whittemore Alumni Association. They're having their first gala that they haven't had in a long time. and tickets are still on sale. So you got an early bird discount that you've noticed on the advertising that's been going around, and that discount is until November 15th. Okay, which is now $55. I think it goes up to $65 after then. Okay, if you got VIP tables available, and also if you want to put an ad in the in the journal, you can do so. Tables are available, business ads, and a souvenir calendar. By the way, you can have if you want to have your business placated on that on the calendar. Look, tickets are going, okay, and I'm not look. And April could tell you that. Look, she's got it on the screen right there right now. Tickets are going, and the ads in the calendar. I don't know what the calendar is going to look like, but they're taking a lot of time to develop these calendars, so it's going to be something beautiful. Okay. And so, and hey, by the way, look, your days won't be once you reach that hotel. Your day won't be without any excitement going on. Okay. The World Community Magazine. Just want to add this tidbit. On Saturday, on that morning before the gala. The gala is on December 23rd. So from 10 to 2, at the Staybridge Suites, not far from the hotel, it's about a block right down the street. The World Community Magazine will host the vintage videos. Look, when you see these videos, don't get terribly excited now, because this is 30 years in making. Okay. We have Whittemore alumni events, and we'll be showing them for the past 30 years. And we also have some historic photos, some memorabilia, and things about the Race Path Corridor. Okay, like Billy McLeod's place. Okay, the bar, and Kelly Drugstore. So you're going to have a good Whittemore Alumni Association gala. That starts at 7 p.m. that day, and we're just going to make that whole weekend for you a glorious weekend, and it's going to be worth your money that you're going to pay for your ticket. Okay, you're going to be at the again, we'll have vintage material at the Staybridge Suites in the meeting room. That's at 303 Fantasy Harbor Boulevard. That's the official address, but you can see it from the hotel if you're going to stay in the hotel where the gala is going to be. Okay, but we'll talk a bit more about that each week, and just to keep you updated, and to make sure that this gala will be worth your while. Okay, there's been a lot of good planning going into this with some very strong people, some people who are using a lot of their expertise, and they're doing some worthwhile planning, and they're continuing to do planning, even though they've sent out the information, and they just want to make it worthwhile. So again, we'll be talking about it again next week, and it will be at the of course, the gala, by the way, going to be at the 4 Points Sheraton. That's at December 23rd, 2023, and it's at 7 p.m. Okay, Whittemore Alumni Gala. And during that day, earlier that day, we're going to make it worth your while. Complete your day. Okay, we can go over to the Staybridge, and you can see all of the memorabilia that the World Community Magazine has developed over the many years, over 20 some years, since 1999. Okay, and videos since 1988. Right, so we got it in store for you. It's going to be a good weekend. Going to be worth your while. Okay. As is shown here on the screen, tickets tables can be purchased at www.whittemorealumniassociation.org. www.whittemorealumniassociation.org. You can still purchase your tickets there. Okay. And that cutoff date is November 15th for the $55 tickets. After that, it goes up to $65. But you're going to be getting a lot. You're going to be getting a lot. So anyway, we're about to run out of time, and thank you all so much for allowing us your viewing pleasure to bring this information to you, and especially Dr. McIver. And of course, my co-host April is working behind the scenes very hard. And of course, the Porterfield Report. Looking forward to that, not next Tuesday, but the following Tuesday, with the report on Conway City Council again. And it's going to be there. You're going to enjoy it, okay? So God bless, Godspeed. Hope to see you next week, 7 p.m. Thank you all. Good night.
Thank you for watching the World Community Magazine's Hour of Power Live on Facebook with your host Edward McQueen and April Garner.